It is World Asthma Day, that chronic disease. Currently, about 4.8 million children under the age of 18 with asthma worldwide, and of course affects many adults too. With us now is Dr. Jagadish Nanjappa, consultant pulmonologist at Mediclinic, Parkview Hospital. Doctor, how are you?
I'm fine, thank you, Helen.
I have got lots of questions, and I'm going to try and keep it professional because anytime I speak to a pulmonologist, I just want to talk about my daughter who does have asthma. So this is a really meaningful conversation for me because we've spent a few unhappy nights in the ICU when she was quite a lot younger. So it is something that a lot of people are living with and struggling with, but I still think there's quite a lot of misunderstanding about it. So I wondered, and forgive me for going really back to basics, for people listening today, are you able to explain to us exactly what is asthma? What's happening in the body, doctor?
Okay. Well, asthma is a chronic inflammation of the airways, wherein patients will have varying degree of cough or breathlessness or wheeze. So it basically affects the airways, and there's a number of reasons why people can get asthma. So that's what I would say asthma is, actually.
Tell us a little bit about the causations, the risk factors. My dad has asthma, my brother has it, and now my daughter has it. I had eczema, so we keep on coming back to this hereditary genetic link. What do we need to know there, Dr. Jagadish?
Okay, so looking at the causes of asthma, basically the majority of the causes is due to allergy exposure. So again, more than 50% of patients, this is the cause of asthma. So they can have other associated allergic conditions like eczema, allergic rhinitis. Allergic rhinitis is an inflammatory reaction in the nostrils due to allergies. We'll come to the family history. So it is important because if you have a parent with asthma, then you are 3 to 6 times more likely to develop asthma than someone who does not have a parent with asthma. So it is important to actually have to look at the family history.
Can I ask then about some of the first signs that you might need to look out for? And let's talk about children in particular. Is there an age when they start maybe exhibiting symptoms?
Yes. So again, colds and coughs are pretty common in children, particularly children who go to nurseries. They pick up the infections. Mm-hmm. So we need to look at treating those infections early, and because viral respiratory infections in childhood, there is a high risk of developing asthma later on in their adult life. So that's something that we need to look out for. And again, the symptoms that we look at is nighttime cough. So we see that the child keeps waking up in the middle of the night, coughing. We need to think about, okay, can this be asthma? And also recurrent coughing episodes after a cold symptom can also be a symptom of that. In the school-going children, so if they are actually lagging behind their friends in terms of exercise ability, so they can't run as long as their peers are running, then we need to start thinking of, do they have exercise-induced asthma? So those are the symptoms. So coughing at night, particularly recurrent infections and breathlessness on exertion is something we need to look out for in children.
It's interesting you mentioned the restless nights, because that's not just an annoyance, for a child who can't get a good night's sleep, and of course their parent as well, but that can impact, fatigue during the day, ability to learn. So it is really important that you're ultimately treating the root cause there. And do you need to go to a doctor such as yourself, a consultant pulmonologist, if you're starting to put the pieces together? Could you go to a family doctor to get the treatment that you need?
Right. Okay. So again, asthma is a lot of time overdiagnosed and sometimes underdiagnosed. So we need to get the right investigations. So again, they need to do these blowing tests. It's called a spirometry, and there are simpler blowing tests called as a pheno test. There's peak flow recordings. Again, if any center has the sort of equipments to do the tests and somebody who can interpret it correctly, then it's fine to get it treated. But they need to have a clear diagnosis, because these are diagnoses for life.
Mm-hmm,
so we can't label somebody as asthmatics when they may not have it.
We're going to go to the text line. Dr. Jagadish with us this afternoon. Message here saying, choose your parents carefully. I have asthma and it's much better here than in a cold country. That's an interesting point in terms of environment. What have you noticed when treating patients in this part of the world, Doctor?
Okay, so I get patients from Europe, UK. So if they have sensitivities to pollen, so some of them actually get better when they come here. Mm-hmm. So if they have more sensitivities to dust and dust mites, then they actually get worse when they come here. So I've seen both sort of, yes.
Now, this is where I'm like, okay, we've got a doctor on who can help me and my family. So my daughter now is 6. And I have to say, she was on Seretide. We were giving her a daily inhaler and she was doing great. And then I have to say, pandemic hit and she wasn't at school that much. And, we noticed actually she was doing really well. So went to the doctor, came off the inhaler. Now we're in this, honestly, shout out to any parents who've got sick kids right now. There seems an awful lot of nastiness going around. I don't know if it's the change in weather or travel, but last week, awful cough, really wheezy. I start getting a bit nervous about it. So started giving her the Ventolin, which made a massive difference. And I just wondered, what is the likelihood of a child growing out of asthma? You said there, it's a lifelong diagnosis, but does it need to be something that you suffer with for the rest of your life?
So, yeah, it's a rule of thirds. So 1/3 of them get better. So they actually grow out of it. So, and 1/3 have a persistent sort of symptoms all their life, and another 1/3 actually get worse. Mm-hmm. So we wouldn't know where the child falls into. So just keeping an eye on their symptoms and continuing the inhaler prescribed by the doctor, and particularly when we talk about the inhaler. Previously, we used to give only the Ventolin, and in fact, from 2019, the guidelines have changed, so we have to give them a combination inhaler of a steroid as well as the bronchodilator, which is Ventolin-like inhalers. So what you mentioned, the Seretide, is one of them.
A really interesting question here from Mustafa on 4001 saying, what about the home? Is it worth looking at extreme cleaning, air purifiers, etc. for a child that has asthma? Thank you for raising that, Mustafa. I think it's interesting to think about things that we have got some control over. What do you tend to recommend in terms of lifestyle factors and that immediate environment?
Yeah, so that's a very good question. This is a very common question I get. So, yes, we need to first understand what is the trigger for asthma in a particular patient. So allergy tests will be useful. So house dust mite, pet allergy. So those are the things that we look at. So these are the two main things that we have to tackle in the environment, in the home environment. Mm-hmm. So if it's house dust mite, then there's a whole lot of things that you need to do at home. The air purifiers can help, but mainly it is the anti-allergy mattress protectors, anti-allergy pillow protectors, which would make a difference. And just not hoover. We need to wipe the windowsills where the child is sleeping, so that there's no dust exposure directly.
I'm literally going to Google an anti-allergy pillow and mattress during the news. Can I also ask you about nebulizers? Because I'd never seen a nebulizer in my life outside of a hospital until I came to the UAE. And then suddenly every single home seems to have one. Having spoken to a doctor friend, she was saying, well, do you know what? I actually wouldn't give a nebulizer to a child unless they lived so far away from a hospital that it would really be, potentially very dangerous if they didn't have one. And I wondered what your take on it was, and if you are in favour of them, how to best use them.
Okay, so again, I've had a very similar experience as you. I've not prescribed any nebulizers when I was working in the UK, But here, what you said is right. Everybody has a nebulizer with them. So nebulizers, the reason why we never gave nebulizers in the UK was because the asthmatic patients would just keep taking the nebulizer. They would not know when to go and see a doctor. Mm-hmm. So when they would reach the hospital, it would be too late, or they may need to get sent to the ICU. So they can be very sick. So just giving them the right education, telling them when to actually use the nebulizer and for how many times, and if it doesn't get better after maybe the second or the third nebulizer, you need to see a doctor. So giving clear instruction, and you know that the patient can actually understand these and follow it, it is okay to give the nebulizer.
Okay. One last question. I'm going to squeeze it in. I'm saying my 11-year-old is on Singular for asthma. He came off it as we thought he was better, but it ended up on it again due to big attacks. When he's on, he has no issues, but are there side effects for long-term use? He needs it in his life, sadly. Thank you. So a parent there asking about an 11-year-old. Any insights there, Dr. Jagadish?
Yes. So as far as possible, we try and avoid tablet form medication, because the inhalers are pretty safe. They are low doses. They act locally in the airways. But there are some patients who actually need something like montelukast, which is the component in the Singular. So risk and benefit. So if there are some people if they stop taking it, they will get an asthma attack. Mm-hmm. So in those patients, they have to be on it. So long-term risks, there are, any medication has risks long-term. So, but the risk and benefit, if it is helping the child significantly, I would keep going with it.
And anything that these parents can do to mitigate any side effects or help manage anything that they might be experiencing?
So, important thing about Singular, there's a black box warning by the FDA. So it is low mood, suicidal ideation. Again, it happens in very small percentage of patients. So these are the things that the parents should keep an eye on. Mm-hmm. And as I told you, it's a very small sort of group of patients, but it needs to be patients and the parents need to be aware of it.
I think that's absolutely key, that information piece, monitoring it, working closely with your doctor to manage the symptoms and indeed any side effects as well. Thank you so much for your time. Is it weird to say Happy World Asthma Day, but I really do appreciate your time. Thank you for joining me on my show today, and I might be coming along to your office sometime soon with a wheezy 6-year-old. I really appreciate it. Dr. Jagadish Nanjappa, consultant pulmonologist, Mediclinic, Parkview Hospital. If you want his details, just send me the word lungs and I'd be very happy to send you a link so you can indeed get in contact with him direct. We couldn't get to your question today.
This content is for informational purposes only and does not intend to substitute professional medical advice, diagnosis or treatment.
And thank you for downloading this episode of the Afternoons with Helen Farmer podcast. Don't forget, you can subscribe. You'll get it direct to your phone as soon as it's out. And you can listen to me live on Dubai Eye 103.8, Monday to Friday between 2 and 5 p.m.
You've been listening to a Dubai Eye 103.8 podcast. To enjoy lots more from Dubai Eye in the United Arab Emirates, just go to DubaiEye1038.com or find them wherever you normally get your podcasts.